Good evening, and thank you all for joining us for another installment of our Ask the Doc series. I'm Titania Bailey, president of Arc of Knowledge, Inc. We are a nonprofit organization that provides resources towards building and strengthening relationships between our generations. And as a part of our generational health and well-being initiative, Arc of Knowledge, Centerpoint Baptist Church, and I have the pleasure of partnering with MedStar Health and their team of specialists to provide education and resources that promote better health practices. So before I introduce our speaker, just a few quick reminders to keep your devices muted throughout the presentation, and all questions can be entered into the chat and will be addressed at the end of the session during the Q&A portion. Our presenter for today's presentation is Dr. Bahram Redjay. Dr. Redjay completed his undergraduate studies at Boston University, followed by medical school at Emory University in Atlanta. He pursued postgraduate training at George Washington and affiliated hospitals, solidifying his expertise in the field. He is distinguished as triple board certified by the American Board of Medical Specialties in Internal Medicine, Pulmonary Diseases, and Sleep Medicine, reflecting his commitment to comprehensive patient care. Currently, Dr. Redjay serves as the subsection chief of the pulmonary department at MedStar Southern Medical Health, where he oversees the management of complex pulmonary conditions. Additionally, he holds the esteemed position director of the sleep clinic at MSSMH, where he leads efforts to address sleep-related disorders. With a career spanning over 3 decades in clinical practice, Dr. Redjay's primary areas of interest encompass pulmonary and sleep medicine. His wealth of experience and dedication to patient well-being have earned him widespread respect within the medical community and among his patients. Please welcome Dr. Bahram Redjay.
Thank you very much for that introduction. I'm going to share my screen here and see if I can put up some slides.
No, o caminan así de machito, o caminan sentados.
Right. Okay. Let's see. Can you hear me?
Yes, we can hear you.
So I think we're having a little bit of problem with the slides here. Let me see if I can download them. Can
There you go. Yep.
Perfect. Good. So we have a short time and a lot of topic to cover. So I like to review some of the major issues that we see in the sleep clinic, some of the sleep disorders, and then allow some time at the end to go over some questions. As you know, we spend more than 1/3 of our life in sleep. And if we look at the brainwave activities of healthy normal volunteers using a test called EEG or electroencephalogram, which is putting some leads on top of the head, we can see that as we sleep, we basically have 2 types of sleep. One is REM or dreaming stage, where we actually the brain activity is very much like we are awake, but the body is actually paralyzed. So there's a dissociation between the brain and the body. And the other type of sleep is a non-REM sleep, which basically is quiet sleep. And in quiet sleep, we have 3 different stages. As we sleep throughout the night, we go through these cycles of non-REM sleep, which is 3 stages, and then we're going to REM. And the whole cycle is about 90 minutes. And in healthy, normal people, we repeat this cycle 2 or 3 times. As we go through the night to early morning hours, we see that we have more REM sleep. And at the beginning of the night, we have more non-REM or quiet sleep. As to exactly what the function of these stages are, as far as we know, probably REM has to do with memory making, and the non-REM has to do with more relaxation and restoration of the body and mind. We can move this away. We classify the sleep disorders into 3 major categories. Primary sleep disorder. These are the sleep disorders that are not associated with mental disorder and then not associated with medical conditions. And then we have sleep disorders that are associated with mental conditions such as anxiety, depression, psychiatric conditions. Examples of primary sleep disorder would be like sleep apnea, narcolepsy. And then we also have sleep disorders that are associated with medical conditions such as arthritis, COPD, or heart condition. We're going to talk about these things a few more minutes later. We also like to classify the sleep disorders into 3 major subtypes. One is insomnia. At one point or another, all of us have had situations where we have experienced this. Basically means lack of sleep. This can be either difficulty initiating sleep, in other words, difficulty falling asleep, or difficulty maintaining sleep or staying asleep. This can be caused by many different things, such as medical conditions, psychiatric conditions. The other subtype of sleep disorder is hypersomnia, where we are always sleepy. The patient is always sleepy. Can be 2 types. One is that the patient is sleepy throughout the day and cannot function. That can be because maybe the patient didn't get enough sleep the night before because of a condition, or it can be a primary hypersomnia condition, or it can be episodes where the patient actually falls asleep all of a sudden and is okay the rest of the day. So it can be episodic or kind of continuous. Then we also have sleep disorders of wake and sleep, which is basically a problem with what is called our circadian rhythm. Circadian rhythm is basically a body clock that we have that it kind of tells us when to fall asleep and when to wake up. Usually this body clock has a 24-hour cycle. If by any reason it's not 24 hours, or if it wakes us up at a different time of the cycle, then there's a disorder that causes the sleep issues. There are also another type of sleep disorder that we call parasomnia. Parasomnias are basically abnormal activity in sleep, which can happen in REM or non-REM sleep. And this is motor activity. If, as we said, if you remember, usually in the sleep, the muscles are kind of like paralyzed. And if the muscles kind of wake up, we have these parasomnia issues, such as talking sleep, or maybe sleepwalking, or night terrors. Sleepwalking would be a situation where the muscles are actually now awake, even though the brain is asleep. Insomnias are, as we said, issues with falling asleep or staying asleep. We categorize it into 3 main different kinds. One is the difficulty initiating sleep. We all experience that we go to bed and we cannot fall asleep. This can happen because maybe we have had a stimulant in our body, coffee or something, and that would prevent us from falling asleep, or we can have difficulty maintaining sleep, which is a condition that we do fall asleep, but for some strange reason, we wake up in the middle of the night. Now, this can be either physiological problems, maybe our oxygen level drops, or again, it could be psychological. Maybe you're worried, concerned about something that kind of wakes us in the middle of the night. And the other type of the insomnia is what we call non-restorative sleep, which basically is a condition that we think we sleep a lot, and we do actually sleep a lot, but the sleep that we get is not restful. So an example of this would be some medical conditions such as fibromyalgia. Now we have different cause of sleep disorder that is caused by medical conditions. An example which is very common would be pain, arthritis, maybe post-operative, or maybe trauma or some things such as that that would prevent us from falling asleep and staying asleep. Other conditions that would cause sleep disorder would maybe heart condition. Usually people with heart disease, they may have a condition called congestive heart failure, where actually the breathing becomes a little bit irregular at night. So at the beginning of the night, we have this shallow breathing, and then the breathing gets bigger and larger, and then it becomes shallow again. What we call chain stop respiration, or crescendo, decrescendo, and then patient stops breathing and the cycle repeats itself again. So this is obviously interferes with sleep, causes arousals or waking up in the middle of the night, or preventing you from falling asleep. Other conditions that can cause sleep disorder is medications. This is something that we see a lot in the sleep clinic. Examples of medications such as the steroids. Steroids can actually cause difficulty initiating sleep or maintaining sleep. Antidepressants is a common medication that can do the same thing. A lot of the heart medications can interfere with the sleep. One of the more notorious medications of the heart condition is beta blockers. It's a very common medication that can cause insomnia. Also, respiratory disorders such as asthma, COPD, emphysema. Patients with emphysema, asthma, they may have lack of oxygen in the middle of the night that can wake them up. There are other conditions called periodic movements. This is a condition that all of a sudden there's some muscle activity in the middle of the night in part of the body and wakes you up. Example of that would be periodic limb movements. And these are situations where the leg muscle actually has impulse, and that movement or electrical activity wakes you up, and this happens throughout the night. Alcohol is one of the notorious substances that a lot of the patients use, thinking that it would relax them at night, would help them fall asleep. But actually, although it is hypnotic at the beginning, it does help you at the beginning to relax you, maybe fall asleep. But as soon as it's metabolized, which takes about 3 to 4 hours in the body, then it becomes a stimulant. So actually, it does help you fall asleep, but it wakes you up 3 or 4 hours later. And chronic use of it results into chronic insomnia. Brain disorders such as dementia or traumatic brain disorders obviously can interfere with good sleep at night. And most important, old age. As we get older, if we look at our brain activity, we see that obviously like sleep is like the rest of the body doesn't function as good as it was when it was younger. So the brain activity is actually become more and more towards the low wave sleeps, and we're gonna lose the amount of sleep that we can get. Usually, maybe everybody is different, but if you were used to getting 7-8 hours of sleep when you were younger, then as you get older, you cannot maintain that quantity of sleep. One of the most common things that problems that we see in the sleep clinic that results into sleep disorder is behavioral causes. We see that patients take a lot of naps during the day. They actually come to the clinic complaining of not being able to sleep at night, but they take a lot of naps. Maybe they take naps late in the evening. When you do that, what happens is that the hormones that are responsible for initiating sleep get used up, and then when you get up from the couch to go to the bedroom, then you cannot fall asleep because the hormones like melatonin, serotonin, and things like that have already been used. Also, if you have irregular sleep schedule, such as going to bed different times of the night, one night going to bed 8 o'clock, another time 10, 12, 2 o'clock in the morning, that interferes with our circadian or normal body cycles clock, and it messes it up, and you cannot fall asleep other nights if you want at a specific time. So it's important that you keep a regular sleep time and a regular wake time throughout your cycle. Lack of physical activity for good sleep to happen, the body needs to be tired. So if you stay in a room all day, and especially with teleworking and things like that in front of the computer all day, chances are, and you don't get any physical activity, chances are that when you go to bed at night, you're not going to be able to fall asleep as you normally would. Some other behavioral no-nos: if you drink too much liquid in the evening before going to bed, especially some stimulants like coffee. Obviously, this is going to wake you up in the middle of the night. You have to go to the bathroom. And if you have other conditions such as anxiety or thinking about your next day, is going to prevent you from falling back asleep. Poor environment of sleep. You want to make sure that the room is comfortable, is not too hot, is not too noisy, is not too cold. For a lot of people that have difficulty falling asleep, it's important that you go through some sort of relaxation techniques, maybe yoga or meditation. We like to say that you have to have a stimulus control therapy. Basically, what that means is that you want to associate your bed with sleep. If you do different things in bed, such as read in bed, or use electronics, work on your phone, watch TV, you have a TV in the bedroom, all of these things kind of interfere with this stimulus control therapy, which basically means that you think that you can go into bed and you don't have to be asleep. So it's a subconscious thing that happens. So it's important that you go to bed only when you're tired and you're sleepy. Again, as we said, regular physical activity, preferably not too late in the evening, because that circadian or that body clock that we have has to work with the body temperature. If you exercise too late in the evening, the body temperature goes up. And when the body temperature goes up, the circadian rhythm in the body doesn't let you fall asleep. So it's important that we do especially if we do very heavy physical activity, we do it early during the day. We don't do it late in the evening so that body temperature can kind of fall down. With the same logic of thinking is if you take a warm shower or something like that before going to bed, that really helps you fall asleep, because after a warm shower or a glass of milk, the body temperature starts to come down, and that's when your melatonin and serotonin and your sleep hormones get secreted and help you fall asleep. Avoid the stimulants in the evening, as we said, coffee, maybe watching a very exciting movie late in the evening, or working, for the things that you have to do next day. These things actually stimulate the brain, doesn't help you relax when you go to bed. Make sure the environment is comfortable. We usually recommend a cool room, not too warm. We recommend a dark room. Of course, you need to have some night light if you have to go to the bathroom so you don't fall. But remember, a bright light always a stimulant, keeps the brain awake. Consider a glass of warm milk or a warm shower before going to bed, and avoid electronics. Hypersomnia is another sleep disorder that we see a lot in the clinic. These are the patients that complain of being sleepy all day. Hyper means too much. Somnia means asleep. So these patients are very sleepy. They're basically two types of hypersomnia. One is that the patient is sleepy throughout the day. They wake up, they're tired throughout the day, and they go to bed tired. Another kind of hypersomnia is that the patients are okay most of the day, and all of a sudden they get these sleep attacks. An example of that would be like narcolepsy. They may fall asleep all of a sudden. Of course, this interferes with social and occupational functioning throughout the day. And some of the societies and, for instance, Department of Transportation, they have become very aware of this condition. If you have a sleep attack and you're a neurosurgeon or a truck driver or a bus driver and fall asleep, it can have catastrophic consequences. So like DOT for truck drivers or bus drivers who have like commercial licenses, they require them have a sleep evaluation, make sure they don't have a sleep disorder or sleep apnea or narcolepsy. Causes of hypersomnia can be different things. It can be sleep apnea. We'll talk about the sleep apnea a little bit later, but this is a condition that basically patients stop breathing, and because of in sleep, and they don't get good sleep, and therefore they're tired and sleepy the next day. It can be because of hypersomnia can be caused by alcohol or intoxication, obviously. Too much drinking makes you sleepy. Same as the central nervous system medications. Some of them like benzodiazepines or antidepressants, they can make you sleepy during the day. If you are on a medication that makes you sleepy and makes you is a stimulant and you stop taking that, would cause withdrawal and would cause sleepiness. Some psychiatric disorders such as depression, bipolar disorder, psychotic disorder causes excessive daytime sleepiness. And if we cannot find any of these causes as a cause of being sleepy during the day, we call it idiopathic hypersomnia at the bottom in here. Idiopathic hypersomnia basically means that you are sleepy during the day, but these things are not the cause of it, and it's something in the body that actually happens that makes you sleepy. Idiopathic means the cause is unknown. Sleep apnea is a condition that we see a lot in the sleep clinic. This is characterized by episodes of stop breathing, in the middle of the night. As we fall asleep, we go to deeper stages of sleep. The muscles relax more and more. And actually, when we are in deep sleep, the muscles are paralyzed. In some people, the back of the throat, when the muscles get paralyzed, they get narrowed, the air doesn't go through, so they start snoring. And then if it's bad enough, then it kind of blocks. So we call it obstructive, means blockage. Sleep in sleep apnea means no breathing. Obviously, this causes arousal, waking up from sleep. Usually, we can have a little bit of apnea throughout the night, but if it's more than 10 seconds, that can be abnormal. That can cause the oxygen level to drop in the body. If the condition is because of the blockage here, we call it obstructive sleep apnea. But we can also have conditions which we call central sleep apneas, which basically means we are asleep and all of a sudden the brain doesn't give the signal to breathe. So we call it central, it's because it comes from the brain and then you stop breathing in the middle of the sleep and the oxygen level drops. We can also have mixed conditions, which is combination of central and obstructive. Obstructive sleep apnea becomes much more common in elderly. As we get older, the muscles in the back of the throat relax a little bit more, they're more floppy. So when we go into the deep sleep, they kind of get paralyzed and they block the breathing. It's more common in obese patients because the fat actually builds up in the back of the throat and the throat gets narrowed. And that relaxation again causes the blockage of the airway to go down. Just a couple of minutes on the treatment for sleep apnea. The most common therapy is what we call CPAP. CPAP stands for continuous positive airway pressure. And what it is basically is a machine that pushes oxygen into the lungs using this device. Has a tube, get connects, and you put a mask, get connected to the mask. And this device was actually invented by Dr. Sullivan about 40 years ago from Australia. And we still use it. But as technology has become better, we have different type of PAP machine, positive airway pressure machine. We call it BiPAP. It has two different levels. APAP is automatic, figures out what pressure you need to keep the back of the throat open. And the CPAP is the one that is continuous pressure. There are some other treatment, such as surgical approach, where there is resection or cutting of some of the blockage in the back of the throat. There are other interventions some of those you see a lot of advertisement on TV. Inspire device, which is implantable, basically pacemaker that is implanted under the skin here and has a wire that goes back up in the back of the throat and it stimulates the muscles in the back of the throat when you sleep. Actually, when when you're ready to go to bed, you turn the battery on and the stimulation happens. The commercials on TV may be a little bit misleading because all they show you is the button that you turn on. But actually there's a pacemaker in there that has to go on. Other interventions for treatment of sleep apnea are dental devices that you can wear. And what it does is actually keep the back of the throat open. There are other devices. Obviously, sleep apnea is a very big business and there's a lot of different interventions that can be helpful. There are some devices that you can put, it's like a necklace you wear at night. And what it does is it stimulates the back of the throat using electrical stimulation. I'd like to spend a few minutes talking about narcolepsy. Narcolepsy is one of those conditions that causes sleepiness during the day, causes hypersomnia. You can have excessive daytime sleepiness. And what actually happens in this condition during the wake hours, all of a sudden the patient falls into REM sleep. remember that dream stage of sleep. So there's something not right here. Patient is awake and all of a sudden goes into REM sleep. And if you remember, we said the REM sleep is that stage that, the muscles relax. So the patients actually feel a little bit of paralysis. Muscle tone is lost. They may lose some of the control of the body. They may fall. And a lot of the patients are mistakenly diagnosed with, syncope, which is like another disorder of passing out, but this is actually narcolepsy. Patients may experience dreamlike activity when they're falling asleep or they're waking up. It can be very scary. They may hear things before falling asleep or waking up, or they may see things that is not there. Sleep paralysis is when the muscles are totally paralyzed or relaxed. It can happen when they're trying to fall asleep or when trying to wake up. It can be very scary. Treatment is medication most of the time. We have a lot of recent good medications for this condition. Another common treatment is trying to prevent the REM from happening. So we inhibit the REM sleep, such as with antidepressants, which are REM inhibitors. Some of the older medications that we used to use a lot, we try not to use anymore, were amphetamines and Ritalins and things like that, but we have better options now, such as modafinil or Provigil or Nuvigil or some of the other newer drugs. Disorders of wake and sleep, if you remember, are those disorders that the body clock is not working right. This can be because maybe if we travel to a different time zone, we travel to an area where it's daytime when actually our home area is nighttime. So our body clock is used to falling asleep during the daytime. We call that jet lag. The more time zone that we travel, the more of a problem this becomes. As the time passes in the new destination, the circadian or body clock adjusts itself slowly and the jet lag goes away. If we are a shift worker, we again interfere with our body clock by wanting to work at night when the body wants to fall asleep, and wanting to sleep during the day when the body wants to be awake. So the way we deal with that is medication. Try to stimulate when we're trying to work, and maybe take some medication to help us fall asleep. Delayed phase syndrome is a condition that our body clock, which is supposed to be on a 24-hour cycle, actually doesn't work right. It may be like 25 hours, 26 hours. And what that means is that we want to go to bed later and later every night. And we want to wake up later and later because the cycle is actually more than 24 hours. Treatment, as we said, we like to use maybe sleep medication for shift worker who has to get some sleep during the day. Sometimes we use some benzodiazepines or Ambiens and things like that, and maybe some stimulation during the day to keep the patient awake, coffee, medications, things like that. Also, if you're in jet lag, we recommend that you go out, get sunlight, because sun is always a stimulant. Instead of staying like in your hotel room in a dark place, that's going to prolong the entraining of your circadian rhythm. By going outside and getting the sunlight, you entrain your body clock faster. In terms of treatment, obviously a patient needs a complete medical and psychiatric evaluation. We have to do blood work. We have to make sure, we're not missing anything, such as high blood sugar, thyroid condition, psychiatric disorders, psychosis, things like that. If we rule out everything and medical checkup is good, there's no psychiatric problem, then in order to diagnose the sleep disorder, we do a test called polysomnography, which basically means patient sleeps in the clinic with a bunch of electrodes and wires connected to them. We look at the brain activity, we look at the muscle activity, the heart activity, the oxygen levels, and we make sure that everything is working okay. Treatment is going to depend on putting everything together. And sometimes it may require medication, adjusting medications or devices that we talked about. I know that we covered a lot of topics in a very short amount of time, but sleep disorder can be very scary. And keep in mind that you're not alone. There are people like me who can help you. Thank you for listening. And I would like to see if there are any questions and take some questions from the audience at this point.
Thank you, Dr. Raja. Yes, we do have some questions. The first one I'm going to take from the chat, which is from Sylvia. She's asking, what is recommendation for the elderly if sleep apnea is more common?
Again, I think we have to make sure that everything else is okay. Elderly can have other medical problems, blood work abnormalities, assuming that everything is okay and the sleep disorder is because of sleep apnea, then they would need a sleep study, evaluation in the sleep clinic by a sleep doctor, polysomnography, which is the test that they do in the clinic. They get hooked up to wires and things like that. And we look for oxygen level. If the oxygen level drops and the patient stops breathing, then we make a diagnosis of sleep apnea and they may need treatment. Treatments can be CPAP or other kind of treatment.
Is melatonin supplementation safe?
Melatonin is actually one of the sleep medications that I recommend to almost everybody who has difficulty initiating sleep. It's a natural product. It is safe. The issue becomes when you actually buy it from regular stores, because there is a melatonin, which is a prescription melatonin and is FDA approved, and you can actually know how much you get. When you go to health stores, these medications are not regulated. So first of all, you may not be getting any melatonin, or you may be getting too much melatonin, which can cause problems by itself. So I recommend some of the brands over the shelf that are well known to us. One of them that I recommend is called REM Fresh, REM Fresh. That usually provides about 3 to 5 milligrams of melatonin, which is what we usually recommend. So the answer is yes, melatonin is safe as long as you're getting melatonin.
Are there any vitamins to improve sleep quality? I've heard that magnesium glycinate helps. Hopefully I said that right.
That's a very good question, and kind of brings us back to the supplements and the health stores and things that are there and things that have claim of helping you sleep better. Honestly, my personal feeling is that a lot of these things don't really help you if you have a normal blood work. Of course, magnesium is a supplement that everybody needs. If you have a low magnesium level, it would help you. Not only would help you with sleep, but it would also help you with your heart condition and everything. But so what I'm saying is that if your blood work is okay, I don't think these supplements are really going to help you with the sleep.
Do you need a referral to get a sleep evaluation?
Yes. And especially that's needed because of some of the health plans that require referral by the primary care physician.
And then I have a few questions that came in to me. How is, and I hope I'm saying this correct, bradycardia
Yes.
related to sleep apnea, and what effect can that have on your health?
Good question. Well, if you remember when I was talking about the sleep apnea, what happens is that the breathing stops and therefore the oxygen level drops. When the oxygen level drops, that puts too much pressure on the heart. And the heart can do unusual activity, such as bradycardia, which basically means the heart rate is going to go down. And if it goes down and down and down, it's not good, because then you're actually going to have, no heart activity, which can be catastrophic. Or it can also cause tachycardia, which basically means going too fast. So the apnea actually can cause both bradycardia and tachycardia. Usually when we sleep, the heart activity kind of slows down in the sleep because we are resting, and it's not like we're running or doing physical activity. The heart comes down, so it is a little bit bradycardic, but in apnea it may get worse, too bradycardic.
I've heard that some people are predisposed to needing more than 8 hours of sleep to function at their peak. Is this true? And is it hereditary?
Another good question. As far as how many hours of sleep we need is all individualized. There are individuals that can function perfectly fine on 4-5 hours of sleep. There are people who need 7-8 hours of sleep, 9 hours of sleep. So if you actually look at the curve, you see that some people fall on this side, some people will fall on this side. Majority of the people in the middle require about 7-8 hours of sleep. The way we know how many hours of sleep we need is just personal experience. For me, for instance, I need 6 hours of sleep. I know if I get less than 6 hours, I'm going to be tired the next day. If I get more than 6 hours, 8-9 hours, I'm still going to be tired. So I know that the ideal amount of sleep for me is 6 hours, but it may be 9 hours for somebody. It may be 4 hours for somebody else. And also we have to make sure that the sleep that we get is quality sleep, not necessarily quantity. That's why we talk, about different things that can cause poor or non-restorative sleep. But if it is good quality sleep, it varies between 4 to 8-9 hours for different individuals.
Do conditions like ADHD or autism affect sleep?
Absolutely. A lot of the psychiatric conditions interfere with sleep, causing difficulty falling asleep, difficulty waking up, being too tired, being too sleepy during the day. Also, medications that we use for these conditions can interfere with the sleep. Because most of these medications are usually stimulants, and the stimulants obviously prevent you from falling asleep.
What is microsleep?
Microsleep is, if you remember when we look at the brain waves, we can tell whether a patient is asleep or they're awake. Microsleep is going into periods of sleep of a very short time, such as a few seconds, maybe a few minutes, by looking at the brain waves. For people who are tired and they haven't slept the night before because of different conditions, they can go through these periods of micro sleep, or if they have a primary sleep disorder, such as narcolepsy, they can fall into micro sleep during the day.
How does age affect insomnia?
As we get older, it becomes more difficult to initiate and maintain the sleep. Initiate, remember, means falling asleep. Maintain means staying asleep. That's just the way it is. We cannot change that. Like as we get older, we get more arthritis because the bones are getting older and they're becoming defective in a way. So same thing with the brain activity. As we get older, it's harder to fall asleep. It's more difficult to maintain sleep. So for a younger person, it may not matter that much what time we go to bed, what time we wake up, what we do. Eventually, they're going to bring that phase to normal. But for elderly, it's important to have a routine that I mentioned a few things. Go to bed regular time every night. Don't go to bed too early because that messes up the sleep cycle. A reasonable time, maybe 9, 10. Stay in sleep for 8, 9 hours. Although you may not be actually sleep, but stay in bed for 8, 9 hours so you can get that rest. Usually, as we age, the total amount of sleep that we get goes down. And as I said before, every individual is different. But if you were getting 9 hours of sleep when you were an adolescent, and now you're in your 70s, you may be getting 5 hours of sleep. Still doesn't mean that's bad, but that's enough for that age.
Is insomnia genetic?
Insomnia can be caused by a lot of different things. Some of those causes can be genetic, such as psychiatric disorder. If you're prone to have depression, which can have a genetic component, anxiety can have a genetic component, you're going to have insomnia. But does it mean if you have insomnia, your siblings are going to have insomnia, or your son, your daughter is going to have insomnia? No. But there is probably some sort of correlation.
How does body position, such as sleeping on your back, affect sleep apnea?
As we go to sleep, the muscles in the back of the throat relax, just like all the muscles in our body. As we go into deep sleep or REM sleep, the muscles get paralyzed. If you look at the anatomy of the breathing in the back of the throat, we see that we have tongue, which is sitting here, and we have that uvula, which is that thing coming down. And if we sleep in a position like that on her back, the tongue actually falls down and the uvula falls down. So it actually blocks our breathing more than it would if we sleep on our side or on our stomach. So the people who have sleep apnea, the worst position to sleep is on your back. The best position to sleep is on your stomach. In between is the side. And that has to do with the tongue and the muscles in the back of the throat falling down in that position and blocking the airways.
Women need more sleep than men.
I'm sorry, I missed that.
Do women need more sleep than men?
Not that I know of. No, I haven't seen any literature that women necessarily need more. The answer is no.
And I only have one more question. It's about restless leg syndrome.
Yes.
And how that is affected, how that affects sleep.
As I had mentioned in one of the slides, maybe we went through it too fast. there are conditions that when we sleep, there's activity in the muscles. Remember we said good sleep is the muscles relax, totally relax. Muscles should be paralyzed. But there are some conditions that actually you're asleep and there's activity in the muscle, like legs. So we call that condition periodic limb movement disorder. Means when we're sleeping, our leg keeps moving, interferes with the sleep. The day condition of that is called restless leg. Restless leg, so if our leg is actually restless during the day, we have to keep moving it, we call it restless leg, but also at night, that interferes with our sleep because there's periodic limb movements and wakes us up from the sleep. There are some good medications for that.
If I do want to take a nap during the day, how long should it last?
For people who have difficulty sleeping at night, I don't recommend taking a nap during the day. Because remember, I said, for the sleep to happen, you need to have all of these, melatonin, serotonin hormones in your brain. So don't use it during the day. It's like how much money you have. You spend all of your money one time, you're not going to have for other times. So don't use all of your hormones by taking a nap. Use it when you want to fall asleep, when you're sleeping. So if you don't have any problem sleeping at night, you're okay with that, I do recommend maybe early afternoon nap as we get older, because that becomes very refreshing. Probably younger individuals don't need a nap. But as you get older, maybe early afternoon nap, don't make it too long. I would say maybe half an hour. If you make it too long, then again, that's going to interfere with your sleep at night.
Why am I tired if I get too much sleep at night?
Too much sleep, if it's a good sleep, remember we said there are some too much sleep that are not really sleep, they're non-restorative. In other words, you do get a lot of sleep, but when we look at the brain activity of these patients, the sleep is not good. But assuming that you're getting really good sleep and you're getting too much of it, it interferes with your circadian rhythm again. It throws it off. Circadian is that body clock. It kind of throws you off and makes you tired. Normal, healthy sleep should be how many hours I need? 6 hours. So I'm going to go to bed maybe, at 11 o'clock at night. I'll wake up at 5. That's what I'm going to do every night. That if you do that, then you really should not, get tired during the day. If you sleep too much, then you're going to throw up that body clock and you can get tired.
Do we have any other questions from the audience? Okay, so I don't have any other questions. And I want to take this opportunity to thank Dr. Reggie for his valuable insights on the importance of sleep and adopting healthy sleep habits. We hope that all of you found this presentation helpful. As always, a big thank you to the MedStar team and our community partners for your collaboration on this important initiative, and to all of you, of course, for joining us. You can see a replay of tonight's session or any of the other Ask a Doc sessions on our Facebook and YouTube pages. All of that's been entered into the chat. And we hope that you'll join us next month, where we will actually have 2 sessions. The first one is the Ask the Lactation Consultant and Mother Baby Nurse, and the Ask the Stroke Expert. So again, thank you all for joining us, and please enjoy your evening.
Thank you.
Thank you.